Hey, welcome back. You know, whether you're walking, running, even standing, it can be uncomfortable if you live with constant knee pain. Good news, there's treatment available, and those who have tried it, they've had great success. Dr. Brad Tolan is a physician with the San Antonio Orthopedic Group. How are you doing,
Good.
Doctor?
Good.
Doing okay?
Thank you.
Great?
Yes.
Okay, what exactly is articular cartilage injury?
Well, articular cartilage is the covering that covers the bone in our joints. And so it's a common area that sometimes can be injured. When articular cartilage deteriorates, it actually turns into arthritis.
Oh, okay.
So
they can be painful.
It can be painful. It causes symptoms of swelling, locking, catching, those type of things that people will develop through an injury or through repetitive activities, typically.
Sometimes it's just use, right?
Overuse can cause it as well, but the end point of damage to the articular cartilage is arthritis, which we all try to avoid.
Mm-hmm. Now, you're recruiting for a study.
Yes.
Tell us about this.
This is called the NeoCart study. It's an FDA study that actually looks at resurfacing these cartilage damage areas. This is a cartilage defect where there's a chunk of cartilage missing. Think of it as a pothole in your cartilage in your joint.
Uh-huh. And that's the place that's either been injured or just use, right?
Correct.
So how is the NeoCart? How is it different?
The typical treatments for these type of defects is typically something called a microfracture, where you actually go in and poke holes in this bone and it creates a little blood clot or scab over the area that matures into a different type of cartilage. It's a repair type of cartilage, and it's not as good as what we're born with. So the NeoCart is a process where you actually take your own cells.
So hold on. So that's the old way of doing it?
That's sort of the gold standard way that people and surgeons have done for years with patients with these type of injuries.
It's not nearly perfect.
No, and in fact, it's not a durable repair. We know over 5 to 7 years they typically wear out. So the NeoCart is actually taking your own cells, growing them, putting them on a membrane, and then going back in and actually putting this almost rubberized cartilage membrane right over the defect so it grows back into your normal cells, with the goal of hopefully being able to prevent arthritis and having a more normal, durable surface that lasts longer.
So who sounds good? I mean, I'm no doctor, but it sounds good, right?
It's the next generation in cartilage replacement.
Next generation. So who's eligible for this?
We're looking for patients between the ages of 18 and 55 that have these type of injuries. And a lot of them, patients need to be screened first to determine if this is truly the source of their pain, but they may be amenable to this type of treatment.
And so if it's your own cells, there's no rejection, I guess?
There's no rejection issues. And again, if it's your own cells, it's more normal tissue that can last as long as you need it to last is the goal. Instead of looking for knee replacements, which is an artificial or mechanical type of implant, we know that will fail at some point in the future. We're hoping that this biologic replacement replaces the area that's damaged and lasts your lifetime.
It sounds very promising.
It
sounds
is.
great.
It is.
Well, thank you, doctor. So if you feel like this study is for you, what you need to do is text knee9 to 87888, or you can call 830-477-0607, or you can also go to the website, neocartimplant.com. Okay.
Great.
Thank you so much, doctor.
Thank you.
Sounds pretty good. Stay with us. We'll be right back.